have gone through different phases of the management of the epidemic in Jamaica. We have seen where we have started to lift the restrictions at our borders to allow persons to come home, Jamaicans to come home. And now, as of June the 15th, we have also opened our borders to non-nationals to come. Now, from June 1 to the present time, to June the 25th, we've had about over 10,000 persons have returned to the island. And from all indications, the numbers are going to increase. As a health ministry, our major thrust has been to keep the numbers below what we are able to respond to. We are in a much better position now than when we started out in January. We have put in a lot of resources, a lot of capacity has been built in terms of training of persons. Persons weren't so willing to take samples. We now have a lot of persons that are trained to take samples. A lot of persons weren't fitted to wear N95 masks in our health sector. A lot of persons have been fitted. We didn't have enough personal protective equipment. We've put in place a lot of inventory management in our facilities and have channeled our ordering of supplies so that we have a more reliable supplies of personal protective equipment. We have put in more facilities for the isolation of persons in our health facilities. We have put in more facilities to be able to manage persons needing high dependency and intensive care. We have put in more facilities in terms of contact tracing. We have done more in terms of being able to monitor persons. We have provided cell phones, tablets through our partners, computers, so that we can digitalize a lot of the process to make it easier to collect information. We have really put in a lot of resources, a lot of capacity has been built that would enable us to manage, because we do recognize that some of the restrictions do have to be lifted, and as they're lifted, the potential for rise is there. But we have kind of raised the level in terms of what our health system is able to manage. But we still don't want it to get to that level, but we have increased our capacity to manage. And as we do lift those restrictions, you will find that the cases go up, and we're hoping that a vaccine will be developed, that the population will continue to develop immunity as more persons are exposed without endangering our vulnerable persons, so therefore keeping our moderate to severe illnesses down.